Good evening, everybody, and welcome to our webinar that specifically will address the Evds system. I think it's very much this something that's a point of discussion in South Africa at the moment. And we all know somebody who's been waiting for a vaccine or hoping for that SMS to come. So I'm really grateful to have Dr. Nicholas Crisp. He's the Deputy Director in the Department of Health with us tonight. Dr. Crisp, I know you are a very busy man, so we do appreciate this hour of your time. And as before, I think we just need a few housekeeping rules. You can write your questions for us in the chat. There is a link for those of you who are not insiders yet to sign up to become an insider for Daily Maverick. Those are the people that keep our independent journalism going. We're really grateful to all of them. And we'll also put out links where you can see vaccination updates, the Department of Health's dashboard, and we'll also put out a registration link. If you have not been registered to get the vaccine yet and you are over 60, please register. We'll make it easy for you tonight. So, Dr. Crisp, I think you can probably best explain your job at the moment. I will just summarize by saying that you really are in the hot seat. So maybe you can tell us to start off with, just from the beginning, to give us a proper overview of how the Evds system works.
Yeah, good evening, Estelle, and good evening to everyone watching. Thank you very much for this hard work. There are many, many staff who work nights and weekends to make sure that we are able to get the system to work, including all our service providers who are involved at various levels. And then, of course, all the healthcare workers on the ground. There are thousands of people working very hard under very difficult circumstances to ensure there's a service. And I think we should acknowledge them because they are actually the ones who work so hard. So maybe just as an introduction, the electronic vaccine data system is the means by which we are able to keep a track on everything that happens within this vaccination rollout. So it is a complex system that involves a registration portal to allow individuals in the community to register. And then it sends communication to people once they've registered. It informs us when to come for our vaccinations. And then it tracks everything to do with that vaccination, from the time you arrive and give consent to what dose you got, what the lot and batch number of that vaccination is, whether you experienced any adverse events that are recorded. And then, of course, for us, for reporting purposes and for management, we are watching which sites are being supported, whether the SMSs are going out. We track every single SMS that's sent to every individual. We're watching the codes. We're monitoring the age groups of people who are using the system. We monitor whether it's being paid for by a medical aid or whether it's being paid for by the state. So everything to do with the accounting and reporting and the data. So as Estelle said in the introduction, we encourage everybody to register. And the starting point is that we are segmenting. It's a policy decision to segment the population into manageable sizes, so that we are able to address the most vulnerable population first. And there were issues around how to determine that. And we've been guided. The minister was given recommendations by 2 ministerial advisory committees, plus discussions in government on how to prioritize who to register first. And the decision was taken, and I know there will be people who will differ with the decision, but the decision was taken to register over 60s first. Now, clearly in the Sonke program, which preceded this and where the Evds was used for management of that process, we were only targeting healthcare workers. Now we are targeting the remaining healthcare workers plus all persons over 60. And the reason why it was decided over 60 is because that is where the concentration of most vulnerable people are, for 2 reasons. One is that age in itself is a risk factor for severe illness and for hospitalization and morbidity and mortality. And there is an abundance of comorbidities in that group already. So trying to target more people or to specifically try and register people with comorbidities is vastly more difficult. It involves persons who are registered. Then the next question everybody asks is, why have I not received a call-up? Where's my appointment? So if we take one step back to what EVDS also does, is that there are sites that are being activated by both the public and the private sector that are able to manage the program and to receive vaccines. Those sites, both public and private, must have a pharmacy permit, and they must have a registration with the government system, the master facility list it's called, and there are very clear data fields we keep so that we know that this is not a fly-by-night or somebody trying to steal the vaccine or defraud us of whatever. So those are public checks to protect us as citizens who are paying for this. Once that's done, the staff on that site, both the administrator of the site plus the management in the site, undergo training on how to use the system. And at that point, they get full control of their own scheduling. And what that means is they then determine the time frames of their schedules. So whether they're having 2 slots in the morning and 2 in the afternoon, they know what their capacity is. So they set the capacity for each of those time slots, and they are able to do a few other minor adjustments, so they can schedule not to do certain things or to change the numbers during those periods, and they then enter their schedule. We are asking them to schedule 3 days ahead. The EVDS has got queues of people to each active site, which is updated once a day at midnight. And so as more sites come online, people in queues can be, virtual queues obviously, can be moved to other sites. So for instance, we may have a site in a city that has got 5,000 people queued, and they're currently doing 250 a day. That means you're going to wait a long time to be called up for your appointment. So if another site comes online and there are people that are in that queue that are now nearer to the new site, then they will be queued to the new site and they'll shift up in a queue in another place. So every day as we're able to bring on new sites with capabilities and they schedule, our queues are being moved around virtually to make sure that we get people appointments as fast as possible. But I do want to say that we need to see the big picture to understand why you are waiting for an appointment. So at the macro level, if I round off the figures, we have just over 3.2 million people registered at the moment, all told in the system, and we have vaccinated just over 1.1 million, and that means that the queue is 2.1 million now, and it's growing all the time as people register, and it's getting smaller on the other side as we vaccinate. So if it's a pretty static size queue, if in a rural area in a smaller town, it's more difficult and more expensive to distribute vaccines and to get live sites in those areas. So we are finding that in some rural areas, especially far-flung areas, it has been slower to get sites activated, both public and private. And it's also about the volumes of people. So people who are insured, who would be the queue for the insured population would be to private sites, and for the uninsured to public sites primarily. And so that is what is happening. At the same time, both the public and private sector are doing outreach services primarily to old age homes. So we know that that's a captive population of people who mostly don't have the ability to register. So the private sector is going to those old age homes, and the public sector is going to the public sector old age homes. And that means that those vaccinators are not available to schedule at a fixed site. So there are many moving parts, but hopefully this sort of puts a perspective. Now there was, if I may continue about walk-ins, because this has been the next thing people have asked. In the early days, because, and I'm talking about 3 weeks ago when we started, we were pushing the SMSs from the center because, as I said, the site managers and administrators did not have control yet of their own scheduling, and there were very few sites. And it's very hard from one office centrally to capture larger areas, people who are being called from greater distances to these very few sites. So people missed their appointments, and the vaccines were available at those sites. So they allowed walk-ins so that the vaccine did not go to waste. But we are now 3 weeks into the program, and in some sites, it's pretty close to 100%, especially some of the bigger private sites where it's insured people with their own motor transports and so forth. It's pretty much 100% of people who get SMSs are now coming because they're getting their SMSs a couple of days ahead of time. They're able to make plans, they have transport and so on. It's not quite as good in all the public sites, and so there are still some walk-ins. And we understand that because those people are using public transport and it may not be as easy for them to get their messages. So we monitor from the EVDS team, we monitor every site. Obviously, they are collective as well as we can drill down to individual sites, and we're able to see where the queues are long and moving slowly, and that is where we then advise our counterparts in the public and the private sector that this is where we need to step up and activate new sites. So we don't get a lot of sites all on top of one another in one place and huge gaps elsewhere. So I think the public will find that as the program gains momentum, the sites will become more accessible. But at the moment, the numbers of vaccines are limited because we've been waiting. We could have brought on more.
So, Doctor, maybe we can just pick up from your last point. We're all waiting for the Johnson & Johnson vaccines to be cleared by the FDA, and we're hoping for this coming week. Are you confident that the EVDS system is ready to handle and send out appointments and get things ready as soon as the Johnson & Johnson vaccines are available for use? Because that, even if they do get cleared tomorrow, I understand there will still be a few days that they will have to but we have to wait before we can use them.
Yeah, so maybe it's good to just take a step back and say what happens to any vaccine, whether it's a COVID vaccine or whether it's for measles or for anything else. Vaccines, the active ingredient, we don't manufacture vaccines in South Africa. We do what's called fill and finish, and we're all aware of the plant in Gqeberha that does that for the COVID vaccine. And there are other vaccines that are filled and finished in South Africa. So the active ingredient is made elsewhere. And in our case, for the Johnson & Johnson vaccine, it's this plant in Baltimore that's in question at Emergent, and that's all in the public space, so people I'm sure, have access to that information. So that vaccine is made in batches, and the batches are sent around the world to finish and filling plants by the manufacturer, and they are then be condemned by the FDA. That is a safety precaution, and it's about contamination and cross-filling within what we call good manufacturing practice in a pharmaceutical plant. And until we get the report, we have no idea whatsoever what is going to happen. It may be several batches, it may be one batch, and we may or may not be affected by all of them. So we have to just be patient, and we were all hoping to understand what was happening on Friday globally, not just in South Africa, and that has now not happened, and now we all on tenterhooks for Monday again. So what happens when a vaccine is then released to a country, to a purchaser, is that our regulator has to verify that that is a bona fide vaccine. And then we go through, in this country, the National Control Laboratory to check the potency of the vaccines, that it's not being compromised, that there are no contaminants, and that we are indeed satisfied that it is what it says it is and it's going to protect our public. The National Control Laboratory takes samples from every batch and every lot. And so that takes time for them to check the paperwork and then to do actual tests to see that what we think we bought and what we think we're going to inject into the public of the country is indeed what we say it is. That is a safety measure that we will not compromise on, and we have to be patient for those 3 or 4 days that it takes. And at the time that it takes depends on the size of the batch and how many samples have to be taken. It's really as simple as that. The National Control Laboratory and our regulator, the South African Health Products Regulatory Authority, or SAHPRA, are completely geared and have been ready for a long time now to handle whatever the outcome is of what we hear from Johnson & Johnson. So that is not related to EVDS. The next process is, of course, then our logistics companies, and there are separate logistics companies for each of the vaccines so that we don't mix them and get them to different places in error. That gears up very fast. They have to make sure they've got their staff rosters done. They must make sure they've got the needles. They're different needles from what we use on the Pfizer vaccine. So their needles and syringes must be ready. But they're all trained. They've got their EVDS training. They know exactly how to do it. And they will be able to schedule once we know the day on which that vaccine will be released and distributed through the logistics network. So the question is, are we ready? We've been ready for some time. And we are anxious to scale up. And the current 70,000 vaccinations a day, our providers are telling us they can double that very quickly. And we know the logistics, we're capable of doing that. So we have to make sure there's a pipeline and that we don't have a stop-start situation where we distribute just a few and then we wait and we close sites down for a few days while we wait for more vaccines. So I suppose for scientific word, we titrate. We let the vaccines into the system to make sure that we've got a continuous flow and we don't open up so many sites that we are unable to maintain that continuous flow. It's nerve-wracking because we are not the manufacturer or the factory that is distributing the vaccines that we've either got on order or already paid for. Thank you.
So thank you very much. I think if I understand you correctly, at the moment, the only thing that's holding us back is that we do not have that many vaccines to distribute every week and every day to what must be hundreds, or are we into thousands of live sites at the moment, or still hundreds? Do you know offhand how many we have?
So and for instance, I mentioned about going to old age homes and so on. Those are not sites in the true sense of the word, but you might see them as sites. So the way the public would view sites might be differently from how we see them. The way the public would see it, we're over 440 odd geographical locations that one would regard as a site at the moment.
So, Doctor, if you are waiting for an SMS, but there is no site in your town or in your immediate vicinity, maybe you can explain to me, how does that work? How does the system treat that registration or the scheduling of an appointment?
Okay, so once you're registered, we're not going to forget you. You're on the register. And even those who were registered as healthcare workers under Sisonke are now queued into the big rollout, the national rollout. And you are queued by first of all, the day in which you registered. That will bring you to a front of a queue. But then you have made some choices, and some are not your choice. So your not your choice is that you live in a particular area, and we may not have a site that is anywhere near where you need to be vaccinated. And until there's a site in 10 kilometers in an urban area or 30 kilometers in a rural area from where you stay, you will not be scheduled. Unless a province, in the case of the public weekend or the morning or the afternoon. So if you have chosen a morning slot, you would have been queued with people who have chosen a morning slot. And if you've chosen a weekend, you'd be queued with people who have chosen the weekend slot. You can go on and register and change those options. You can't change your ID number, and you shouldn't change your name. But if you have changed your name, you actually can do that. And you do not lose your place in the queue. You're merely exercising a change of information. So, for instance, I used to live in the Western Cape when this all started. I now live in Gauteng, and I've moved, so I can change my registration to now be queued here in Gauteng and not in the Western Cape. So, so that's what I think the message is. But there will be sites. Eventually, we have already got more than 3,000 sites planned. It's just not logistically sensible to open them all when we don't have a free flow of vaccines yet.
So I think, given the times that we live in, there maybe people are a little bit frustrated and impatient. I think we've got the new rise of the vaccine jealousy now in South Africa. But maybe if we can get an assurance that this is not like a Black Friday sale, that if it's finished, it's finished, that there will be, the plan is that everybody will be vaccinated as soon as possible.
Yes, so first and then following all of us. But until we get a significant portion of our total population, which we hear various calculations, but I think we can assume we need to vaccinate at least 2/3 of the population before we can say we are all protected together. So we are doing everything we can to find other vaccines, other ways to purchase, to find vaccines that other countries may not be using. But there's science to this as well. You can't just get any vaccine. You must make sure that the vaccine that we choose and we import is going to have the required immune response in our country. And at this stage, that is what we have. And we trust that, well, we hope and pray that we don't get more variants that are not going to be covered by these vaccines. And this is something new to us. The science keeps changing. I'm sure you're going to ask me, so I'll tell you anyway. We started off with the rule that 21 days after your first dose of Pfizer, you must come for another vaccination. Since then, there's evidence that 42 days actually appears to confer better immunity than 21 days. Why that would be, I don't know. But that is what we have heard. And that is for several reasons really good, because it means we can get a larger number of people to have the first dose before we have to start vaccinating the second dose. And more people then have some immunity, if not the full immunity of the requirements. We've now had advisories and clearance from our regulator that it's safe to store it in a less stringent, I don't want to say it isn't stringent, but perhaps a more manageable way.
So I want to now turn to some questions. So we've got two sets of questions. Thank you very much to everybody who submitted questions beforehand. Professor Richard Cook, who is the vaccination site lead at Prisani Baragwana, sent us some interesting questions that he needs to answer every day. And I think that makes sense for you to, just because this is a lot of what we want today to be about. And I think you have answered some of them, but one of the big things that I think also causes a little bit of anger is the ongoing issue of walk-ins. I think you have said that the site managers are given the sort of discretion on what to do, but it seems that there are different policies that differ between provinces. I think some of the rural provinces, like here in the Eastern Cape or KwaZulu-Natal, they'll just vaccinate anybody, even if they come to ask, they'll register and vaccinate. What is and I understood what you said, that in the beginning things were a little bit different. So what is the current sort of policy and thinking around walk-ins at sites?
Okay, so the national policy is you can vaccinate. But if people have walked in, they must wait. And if you have to wait till the end of the day and you haven't been scheduled, then you can't complain because you've taken a chance. Good for you. Once you are vaccinated, your record will show as such, and you will not receive an SMS to say you must come for vaccination because the system now knows you came and you were vaccinated. On the record, we monitor and we can see that how many people were sent an SMS from this site and came to this site. We can see how many people were sent an SMS from this site, but how many came despite getting an SMS to go to a different site. And we can see who came and was not sent an SMS at all. And we are able to then track and see consistent walk-in numbers, if you like, or percentages of what was scheduled, because our system shows us the percentage as well. And as I indicated, some of the big centers, particularly in the private sector where we know people have access to transport, are now operating very close to 100%. So if you try and walk into some of those bigger private centers now as an insured person and are told to wait or to come back or go away, well, you shouldn't be surprised. In the public sector, the public has less access to SMSs, less access to transports and so on. So in parts of the country, there are still large numbers that if large numbers of people arrive at a site that can't handle large numbers of people, we may create inadvertently some kind of super spreader event, and we don't want that to happen. So we've seen the announcements that have been made by both officials and politicians around different provinces, and I'm sure that they will, as their circumstances change on the ground, advise what the order of the day is at that time. So that's the official policy right now.
Okay. And then I think you have touched on it, but I know I think maybe you can share with us, why did the EVDS technicians, why did you have to close the health worker vaccination site? And I think you have said that health workers are now scheduled into the general queue, but maybe just talk us through what happened there.
Okay, so the Sisonke trial was targeting healthcare workers. But the definition of a healthcare worker is not just a health professional, it's people who work in the health sector, and the target was frontline workers. So you wouldn't expect to have people who work in the admin office of a hospital regarded as frontline workers. And there are many other people who work in the health sector who may not be a frontline worker, but are extremely vulnerable. They may work as porters, ferrying people, a controlled environment. But once the Sisonke trial ended and we moved to the open system, the same EVDS now had to continue to register healthcare workers as well as the over 60s. And there's no way to verify a worker who's not registered with a health professional council that they are indeed a health worker. So what happened was, and we already had this during the Sisonke trial, complaints that some health practitioners were registering family members and friends and so forth. So we knew that was already a challenge, but it went crazy in the first week of the rollout. And everybody was now saying, well, lots of people were sending messages to one another saying, hey, you don't have to, even if you write any number in there, you can still come. There's no way they don't verify you at the site. You can just come. And people who had towed the line and who were responding to legitimate appointments and who are older people were legitimately very unhappy, especially because some of these people were now coming to the front of the queue because they were being scheduled and they were ostensibly healthcare workers. So without a means to control legitimacy, we were forced to close that portal. So a number of things happened. One is the remaining professional registered healthcare workers who have not registered. I mean, I find it very difficult to understand why people haven't registered, but they are. So we need to cater for those people, and there is a site. We have been working with another service provider who provides a verification interface. So it's called V4HCW, so vaccines for healthcare workers, but the word, not the word for, the numeral 4, V4HCW. And when a healthcare professional goes to that site and enters their practice number, and that's a pharmacist, a nurse, a doctor, dentist, whatever, that site verifies that that person is indeed a professional. And if it verifies, then it passes on the information and allows the registration onto the EVDS. The second group and the second method that we have developed is for public health workers. So those in the 9 provincial departments and the National Department of Health who have legitimate numbers on the payroll system of the government, the per-cell system. And we have a direct interface off that database. It's not directly into per-cell, obviously, but it's a subset database. And so now it is possible for those healthcare workers to be registered on the system. That requires some honesty and integrity. But if we find people that are abusing that system, instead of stopping the system, we will take ethical and legal action against the people who are getting around. But that system's not available yet. We are still working on that one. So that is what happened.
Okay. So we've got one of our readers who said the 6th of June is my 73rd birthday. Sorry, sir, you didn't leave your name, but happy birthday for today. And they've registered on the 17th of April and with Discovery. So they've insured. And then he says, I have a high blood pressure, but I have not received my call-up message yet. But healthy friends 10 years younger have had their appointments scheduled and have been vaccinated. So I think this is a general confusion that people seem to think that the older and the sicker, but there is no, I think we need to just make it clear that you do not measure health conditions when you schedule appointments. And the only thing that you do is time that you are available and location, and if there is a site close to your house where you can go.
Yeah.
Okay.
So
All right.
maybe to try and put perspective on that, let me give you my own personal case. I'm also over 60, and I also registered some time back. And as I said, I've now relocated from one province to another, but our stage was scheduling 200 vaccinations a day. So I know that I would be waiting somewhere, if they're not seeing the weekend, 8 working days or thereabouts, and I expect to receive an SMS sometime towards the end of this coming week. And if I do, then I know the system's doing exactly what it's supposed to do. So we also think in the modern world that if we're standing next to somebody else and we register together, that we're going to be together in the queue. But somewhere else, your neighbor and someone down the road and someone 10 kilometers away is pushing the button split seconds before you, and you may have 40 or 50 or even 1,000 between you. And that's why we don't all win the lottery.
Okay. And I think that answers the next question where somebody said, I feel obliged to follow the rules. When should I give up waiting for an appointment?
No, you never give up. You will get an appointment.
Okay.
You will get an appointment. There are 2.2 million people in the queue with you at the moment, me included, and you will get an appointment.
And then an interesting question, is the EVDS system available in English at the moment and not in any of the other languages? So if you have to register, it's just English.
Yes,
so I think that's where the President and the Minister of Health's call come in, that we help the elderly to register. But I think if I understand correctly, people
with help desks at pension pay points and at various retail outlets around that, where people go to shop after getting their pensions. If you're in the private sector, there's no obligation on the pharmacy to help you. We can't give an instruction to them. Every business is busy and does their own things, but they have said that they will try to help people to register, and I'm sure that where it's possible, they will do that. We also have an agreement with the private sector that anyone over the age of 80, even if they're uninsured, if they arrive at a private site, they will be helped and they will be vaccinated, and the state will pay for that even though they're at a private site. Because I think we realize that the older you are, the more vulnerable and more difficult it is for you to get around. So there are exceptions like that where we have very good working relationship with the private sector, but it's just make sure that we as the public sector can account for what we are buying and what we are paying for with the public purse. So you will be helped. I smile because I'm at that generation where we're not as computer savvy as our kids and our grandchildren. And I think that we would like to ask younger people and those who are tech savvy to help those of us who are perhaps have got arthritis and can't push all those buttons or don't have a smartphone and don't know how to do the SMSing, don't have a computer, we just and give their cell phone number so that when the message comes, they can communicate with the elderly person. We would ask the same of an insured person. If there's a family member whose cell phone could be given, because some of us get a bit forgetful and it's confusing when you get all these SMSs, you're not quite sure what to do with it. So we really do require society to pull together and help one another.
So we've received a number of questions on people who have received the first Pfizer vaccine, and they've got two concerns. The one is, must they then go to the same place where they had the first vaccine? And then the second question is, what if the vaccines run out before they can get their second one? So are we assured that people will there's enough second dose vaccines for everybody at the moment?
Yeah, that's a great question. Okay, so you will have received a message to say, please ignore your 21-day appointment and don't honor that card. And I would beg that we all please go on a massive campaign to tell people, if you come before 42 days, 6 weeks, the system will not allow your vaccination. That's partly because of the logistics planning, and that's why the SMSing is so important. But it's also because we're trying to get more people to get the first dose of vaccine. So please do not come back at 21 days. Don't even count the days. Don't worry about that card. You will get an appointment queue for that day for appointments. Now, the question of whether you've got to go back to the same site, we've had many discussions about this. We are obviously bringing on, we only had 103 or thereabout, no, not even, about 100 sites on that first day. And on the second day, maybe 1 or 2 more, and I don't remember the exact numbers. It seems like a lifetime ago. But there are vastly more sites now than there were then. So it seems unfair to ask people to go the longer distances to where we had sent them the first time. And it may be that it's much more appropriate now that when we refresh on a 24-hour basis and there's a new site that's opened up that has numbers, that we would rather schedule you to a site nearer to you. So that at this stage, that is what we are programming. And last week, Friday, when we had our meeting, we have daily meetings, we have agreed to amend the rules to make that possible. And of course, it's a long time before the 42 days, so that rule set will be applied to the system well in advance of that. So hopefully you'll get a more convenient second site for your second dose than your first, if it was inconvenient the first time.
And then I think that we've had a lot of similar questions, but one of our attendees have asked, Caroline de Braganza, have asked, she says, I'm 71. I haven't registered on EVDS as I don't have transport. I live in Broederstroom and I'm worried that I'll be sent to a site.
Those around you, family members, friends, or community support structures, to get you to that vaccination site. There are a number of things you can do. The first is not honor the appointment, and you will be rescheduled automatically within 7 days by the EVDS system. If you fail to meet that appointment, it will happen again a third time. Alternatively, what you could do, and after the 3 missed appointments, what you can do is you can make contact with the helpline and you can ask them for a way to receive help. Now, the health departments in the public sector are doing outreaches and are trying hard to reach people that we recognize, and we report to them, especially if there's communities where it's clear that there's inaccessibility. They may not get to everybody in a short space of time, but they are aware of communities where there are challenges like that, and they may send a community health worker or somebody else in the health system to come and assist you. But we do not want to miss you, and we do want to make sure we know about you, and we can only do that if you register. That's the starting point.
Okay.
Just looking for the helpline number. I can't remember it offhand.
We will post it in the group chat that you want to get your vaccine somewhere else, or can you then wait to come home once you're home to get it after 42 days?
Yeah. So after each appointment that you're given, you will get that appointment plus 2 options of automatically scheduled reappointments. But we know that people go away and they go on business trips and they travel between cities, and we live our lives. So if you know and your schedule is predictable and you know that you are going to be away for months, then it would be better to go on the system and change the details so that we know that the system will now know that you have moved from one province or town to another one, and it will then search for your area against a different set of active sites. If it's unpredictable and you really don't know, and for some reason you are very mobile and you miss an appointment, that's fine. Then you're going to get another appointment, and hopefully you're able to honor that one. And as I said, a third one. And if all of that fails, then there's the helpline. And they will be able to recognize that you are not in hospital, you are not deceased, you have not left the country, you are a person who we need to be concerned about, and they will then...
There's been a lot of social media chat about this, but maybe you can just tell us the truth. Has there been vaccinations that got lost or spoiled or destroyed? Did something happen at the sites, or is everything going to plan at the moment?
Yeah, Estelle, so there are, in any vaccination program, we would recognize health workers who, and I mean, I've been working in vaccination programs since 1984, so I know that this is how it works. There's always what we call planned loss or planned waste, where at the end of a day or at the end of a vaccination session, sometimes there are some doses that are lost because the vial's already open, you can't continue to use it. Obviously, we monitor that to check on a site-by-site basis to check that it's not a consistent problem. The other thing is that this vaccine is 6 doses in a vial. That's what the manufacturer says. But we have been informed that many staff who are doing the vaccinations are not succeeding in getting 6. It's a very small volume. They're not succeeding in getting 6 doses out of a vial. They get 5 and there's a bit left over, and they're not allowed to mix between the vials, so that little bit is lost and you only get 5. Now, 5 out of 6 is a 15% loss, and that is, of concern. So the service providers are aware that this is an issue, and hopefully over
the way it predicts the NHI, and there's been a whole lot of conversations about this. But I think maybe you could tell us, how do you measure the success of the Evds system, and how will you measure it, say, in 6 months' time?
Yeah, Estelle, so there's the success of the system and there's the success of the rollout. The success of the rollout is dependent on the reportable details that we monitor in both the Evds system and what we call the SVS system, the stock visibility system. So we are watching the relationship between the 2 systems all the time. Where's the stock? Centrally, right the way to the periphery. And where are the vaccinations, the registrations taking place, the vaccinations taking place, and how do they match one another? So the Evds system, we want to know that we are targeting and we are sending SMSs when we said we were going to send them. And if we get 1 or 2 that go awry, that's obviously something we are irritated by and we would like to improve on. So we'd like to know the case samples from individuals with the ID number so we can find out why that went wrong. But we get, for every 1 complaint we get 90 or more, yay, I've got my vaccination and I got my SMS and whatever. So our success, if we are able to account for what we do. We want to be able to know that people are being vaccinated, that they are getting called for appointments, that vaccines are being matched to the appointments that are being scheduled, and so on. And we are able to monitor, site by site. And if people query what's going on, we can actually track right through their personal record and say which SMSs were sent at what time, on what day, what vaccine, what dose. And if the system does that, then the system is working. Now, of course, we are all users. So if you ask me to use this webinar jam for the first time, I may press a wrong button or do whatever because I'm not a familiar user. And so there's human error as well. So we are really trying hard to make sure the users of the Evds, right the way down to the sites, are appropriately trained and are familiar with what they can and can't do on the system. And if they have trouble, then there's a separate call center where they can call to say, I need help. I'm not quite sure if I've done this right and I pressed the button too soon, and then we can deal with that and reverse it. So the question of the system working, right now it's working, doing exactly what it's supposed to do, and we are very happy with its performance. The question of whether the rollout is working, we are incredibly frustrated that we don't have enough vaccine.
So I think just to summarize, if we can give people who are anxious about not getting the SMS a plan on what to do, if they phone, I think I've done it myself last week to help someone. If you phone the hotline, they can check for you if your registration has gone through. So I've seen a lot of people that said, I've registered 6 times. That doesn't mean that 6 vaccines get scheduled for that person. The system only schedules it once per ID number. Is that correct?
That's
okay.
Correct.
So if there is any anxieties or stress that you might miss your, that you didn't register or didn't do it right, you can just phone the hotline and they will assist you to check if you are properly registered.
Yeah.
And then, just want to ask, so this week, are we getting more sites that are going to come online in the coming week, or are we waiting now to see what's happening with Johnson & Johnson?
Yeah, so the sites that are currently live, particularly in the public sector, are operating at capacity, and we are not really able, well, we're definitely not able to give them more vaccine than they would like. They're all extremely frustrated and begging us to send them more vaccine. We just can't. In the private sector, the question is about dilution, if you like, distributing the same amount of vaccine that's allocated to the private sector is available to us, then we will start to gear up very quickly.
Okay. So thank you very much, Dr. Crisp. Thank you, everybody who joined us today. Maybe, Doc, if you can just summarize for us, list the last few words on you trust your system. I can see you'll let us know when you've gone for your vaccine. What are your last comments on the system?
So, well, I would like to comment about vaccination and COVID in general to say we need to take this disease seriously. It is a real threat. Do not listen to people who tell you otherwise and say that it's a hoax and so forth. The vaccine is the way that we are going to get greater immunity in the community in a reasonable time. So we are doing everything that we can, and we appreciate that people do take it seriously and are registering. Please register, but please keep wearing your mask. Please watch social distancing. Do not get yourself exposed into groups where you don't have to. Keep on sanitizing your hands and creating awareness amongst others. And the bottom line is, we are in this together. I've said it in other forums and I'll say it again. My neighbor's health is my health. And if we are unable to protect one another, we are going to suffer together as a community and we're going to prolong the agony. So really it's about helping one another to register and to stay safe. And that's the best that we can do at this stage. Thank you.
Thank you very much. I want to thank Dr. Crisp for joining us. He is a very busy man. And to take an hour of his time, we really are very appreciative. People have suffered tremendous loss. And we also do want to thank the health workers that run the vaccination sites and also your team, Dr. Crisp, that works hard to get everybody vaccinated. So stay safe and we'll hope to see you soon. Thank you.
Thank you very much.